Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, a cardiologist from Houston, Texas. Welcome to Dr. NIK, a medical educational series. The information provided in these series of presentations is for information and educational purposes only and is not a medical advice. Please consult with your physician for any specific medical advice or recommendations. Please do subscribe to our YouTube channel and let us begin with the feature presentation. What causes chest pain? Here's a long list of conditions that can cause chest pain, and I am going to make sure that I simplify this so that you have a much better understanding of what causes chest pain. The causes of chest pain can vary depending upon the age of the person and depending on the number of risk factors such as diabetes, hypertension, high cholesterol, family history, smoking, among others. So I brought up this chest x-ray so that we can focus on the causes arising from the chest, and then we will also look at causes arising from the stomach area. Here is the chest x-ray showing the heart, then we have the ribs, and inside the chest cavity we have the lungs and a sheath that covers the lung known as the pleura. Similarly, the heart has a covering which we will talk about, which is called the pericardium. So some of the causes that can lead to chest pain coming from the chest could include like a rib fracture, or it could be related to pleurisy. Usually the type of pain that we experience with pleurisy is like a constricting pain which gets worse with deep inspiration and gets better with expiration. Similarly, we have a sheath that covers the heart known as the pericardium, and we'll talk about that. The most common cause of chest pain in adults over the age of 40 to 50 years is coronary artery disease. That is a blockage of the coronary arteries that causes reduced circulation to the heart muscle, resulting in chest pain or what is called angina. Sometimes people can have abnormalities involving the cardiac muscle, and I'll talk about that in a few minutes. And the second part involves the structures that are connected to the stomach, the esophagus, gallbladder, among others. So let us focus now on the chest pain caused by structures within the chest cavity. As I already mentioned, here is a picture of the lungs which shows a lining that is known as the pleura. Both the left and the right lungs each have a sac that is encircling the lungs. That's the pleura. Inflammation of the pleura can give rise to pleurisy. Pleurisy pain, as I explained already, is related to deep inspiration and it gets better with expiration. Pericarditis pain is resulting from inflammation of the sheath that covers the heart itself. There may be associated fever, malaise. There may also be associated fluid collection within the pericardial sac known as the pericardial effusion. Similarly, when there is fluid accumulation in the pleural space, it is called the pleural effusion. Now, coronary artery disease, as I said, is the most common cause for chest pain in adults over the age of 45 to 50, especially if they have multiple risk factors like hypertension, diabetes, high cholesterol, family history, smoking. That leads to buildup of a plaque or cholesterol plaques within the artery, which dramatically reduces the blood circulation to the heart muscle beyond the blockage that results in chest pain. Coronary artery disease can be diagnosed with various tests, which will be a topic for our next presentation. How do we diagnose chest pain? I mentioned about cardiomyopathy. Cardiomyopathy simply means abnormalities involving the heart muscle. Sometimes we can see a heart muscle which is abnormally thickened compared to a normal heart muscle. When the heart muscle is extremely thickened, it is known as hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy can cause chest pain, especially in young people who can have irregular heart rhythms, and you have rarely heard about athletes falling dead on the sports field, and they may have these types of cardiomyopathies or maybe narrowing of the aortic valve known as aortic stenosis. So these are some of the common causes for chest pain arising from the chest. Now let's look at here is a bigger example of a pericardial sheath that has been opened, showing the coronary arteries that are supplying the heart muscle. Now let's look at some of the causes arising from what we call below the diaphragm. And below the diaphragm we have the foot pipe or the esophagus, then we have the stomach along with the gallbladder. Any one of these can produce epigastric pain or the lower chest pain, which can mimic heart disease. There are a number of conditions involving the esophagus that can give rise to chest pain, namely esophageal spasm, which may mimic heart pains, esophagitis or inflammation of the foot pipe. There could be like a hiatal hernia where a part of the stomach bulges into the chest, causing acid reflux or GERD. Similarly, gastritis or peptic ulcer disease or inflammation of the stomach can give rise to pain that can be felt in the chest. It is not uncommon for people with gallbladder problems to have pain not only in the right upper quadrant of the abdomen, but also this pain may be radiated to the chest, sometimes mimicking heart attack. And I have seen patients who had gallbladder attacks who look like people with heart attacks, and we have people with heart attack who present like they are having a gallbladder attack. Hence it is important to do a complete examination and all the necessary tests to make sure that we differentiate the various causes of chest pain. So in a nutshell, this is a brief description of all the different things that can cause chest pain. Usually the pain arising from the gastrointestinal tract is related to food more often than exertion, as it is in patients with the coronary artery disease. Sometimes the food may aggravate this pain. If you want to learn more about the heart, you can browse through our book on Amazon.com, Heart Healthy Lifestyle. There's also a book on stress-free lifestyle. If all of these are giving you stress, then you can read Nick's Comedy for relief. Please do subscribe to our YouTube channel, and in the next presentation I am going to talk about how do we diagnose chest pain and pinpoint the cause for chest pain. Thank you so much for watching, and please do subscribe to our YouTube channel, and we will see you next time. I am Dr. NIK NIKAM.